Welcome to the deep dive. Have you ever considered how a seemingly minor anatomical detail could completely sideline a champion mare's breeding career? We're talking about something as subtle as air getting where it absolutely shouldn't. It's an often overlooked aspect of animal health, but it has massive, silent implications for mare fertility. Today, we're diving deep into two interconnected conditions, equine pneumovagina and pneumoterus. These are, fascinating conditions involving the abnormal presence of air in a mare's reproductive tract. Our mission today is to unpack what causes them, the surprising ways they manifest, how they are diagnosed, and the treatments that can literally turn a mare's fertility around, or, help you understand why it might be at risk. Consider this your shortcut to understanding complex veterinary issues that have significant real-world impact for horse owners and enthusiasts. It's about gaining crucial knowledge quickly and clearly, helping you spot these silent saboteurs.
That's right. And we're going to start with pneumovagina, often known as wind-sucking. This condition is quite literally the aspiration or sucking in of air into the vagina. It happens when the vulvar lips, which are supposed to form a tight seal, fail to do so. This allows air to be drawn in, especially when the mare moves or strains or even just changes position. You might actually hear it sometimes.
So if a mare is wind-sucking, it's not just some cute quirk, right? It signals a deeper problem. What's the root cause you most often see in practice? Is it usually obvious or something more subtle?
Well, what's truly eye-opening here is that the most common culprit isn't some complex disease, but actually a subtle anatomical quirk. Poor perineal conformation. It's often invisible to the untrained eye, yet it can, wreak havoc. Think of it like this. The mare's natural anatomy isn't quite right to form that crucial seal. We often see this with what's called a sunken anus, where the anus appears recessed. This is particularly common in older, thinner mares, or maybe even heavily muscled mares like thoroughbreds. As they age or lose condition, the fat and muscle around the anus can atrophy, sort of shrink, pulling the anus forward and downward. This in turn pulls the vulva into a more horizontal or flat angle, rather than its ideal, nearly vertical position. And that's the main gateway for air and contaminants.
Right, the angle changes. So it's not just the anus then. What other conformational factors contribute, making mares susceptible to this?
Yeah, beyond just the sunken anus, other factors definitely contribute. An excessively horizontal vulvar angle itself can be a problem, or maybe a vulva that's simply too short relative to the pelvic brim. All of these kind of open the door, quite literally, for air and even fecal material to enter.
And I guess it makes sense that age plays a role too. You mentioned older mares and those that have foaled multiple times.
Exactly. They're more prone because of the cumulative stretching of tissues during foaling and just general age-related tissue atrophy.
But are there other scenarios that might compromise that crucial vulvar seal? Other causes?
Yes, absolutely. Perineal lacerations are a big one, especially second-degree tears that can happen during foaling. They can disrupt the vulvar integrity. We also see issues with previous perineal surgery where maybe scarring or an inadequate repair can be a problem, or even direct trauma to the perineal region. And then there are factors like a genetic predisposition, potentially a sway back, loss of vaginal fat, and just repeated pregnancies can also predispose them. Oh, and poor nutritional condition is another risk factor contributing to that tissue atrophy we mentioned earlier.
Okay, let's unpack this and talk about the clinical signs. For an owner listening right now, what might they actually see or hear if a mare has pneumovagina? What are those key clues that something is wrong?
Well, the most obvious sign, as we mentioned, is often an audible sucking sound. You'll hear it particularly when the mare trots or canters, or even when she defecates or strains sometimes. It's that distinctive, sort of unmissable sound that really alerts you.
That distinctive sound is certainly a dead giveaway. Okay, what else should owners be looking for? Any visual signs?
Yeah, another key diagnostic clue is fecal staining or soiling around the vulva and perineum. This clearly indicates that fecal material isn't just sitting outside, but is actually being aspirated into the vagina. That's a big red flag. Beyond that, mares often develop a chronic vaginal discharge. It can be white or mucoid or even pus-like, indicating an underlying infection.
And here's where it gets really significant, right? The consequence for a mare's fertility. This condition isn't just cosmetic, is it? It affects breeding.
No, not at all. That's the crucial part. The most significant consequence is recurrent endometritis. That's a persistent uterine infection. When air and often fecal contamination are aspirated into the vagina, they continuously infect the uterus, leading to chronic inflammation. This creates a very hostile environment, making the mare infertile, often causing her to fail to conceive or maybe experience early embryonic death. And if the pneumovagina is severe and persistent, it can eventually lead to pneumoterus, which is air directly in the uterus itself. Ultimately, what you see is overall subfertility or outright infertility. I remember one client who was convinced her mare just couldn't get pregnant for years.
Oh, really?
Yeah, and it had turned out to be a severe case of windsucking causing these constant low-grade uterine infections. Simple fix, big impact.
It sounds like a potentially dire situation for these mares, with their fertility really on the line.
Yeah.
But thankfully, veterinary science has a remarkably elegant and effective solution you mentioned. Tell us about the game changer here.
It absolutely does. The primary treatment for pneumovagina is surgical correction, aiming to create an effective vulvar seal. And the definitive fix is a procedure called Kaslick's movoplasty, often just called a Kaslick's operation. It's a remarkably simple, really effective, and very commonly performed surgical procedure. Essentially, the vet creates a tighter seal by carefully suturing the upper part of the vulva together. It's much like drawing a curtain, physically blocking air and debris from entering.
That sounds like a pretty straightforward fix, but there's a crucial timing element to it, right? You mentioned that before. What do owners need to be absolutely aware of regarding this procedure, especially if their mare is in foal?
Yes. You're hitting on a critical point there. The Kaslick suture line must be opened up prior to foaling. This is absolutely critical to prevent severe perineal tearing during delivery. Usually it's done about 5 to 10 days before the mare is due to foal.
Right. Forgetting that could cause major problems.
Huge problems, yes. Forgetting this can lead to really severe damage. The good news is it can be easily resutured post-foaling or even after breeding and confirming ovulation if needed for the next breeding season. It's a quick, simple procedure to reopen and then resuture later.
That's a huge advantage then. What are the other benefits of a Kaslick's, and are there more extensive options for the really severe cases?
Yeah.
Maybe where a simple Kaslick isn't enough.
Well, the advantages of a Kaslick's are clear. It's simple, it's relatively inexpensive, it's highly effective, and it generally has minimal complications. For most uncomplicated cases, it's truly a marvel. However, for more severe cases, especially those involving extensive perineal lacerations from foaling, other surgical options exist. Things like perineoplasty or episioplasty, which involve more extensive reconstruction of the perineal body. And for really extremely poor vulvar conformation or maybe torn perineal bodies, there are specific techniques like the Pare or GAD procedures. These might be necessary to literally reconstruct the area to provide a functional seal. Much more involved, obviously.
Okay. And it's not just about the surgery itself, is it? If there's an existing infection, you can't just fix the anatomy and expect everything to resolve on its own, can you? It sounds like we need a more holistic approach.
Exactly. That's spot on. It's crucial to concurrently treat any existing endometritis. That means thorough uterine lavage, flushing the uterus out, and using appropriate antibiotics, usually based on culture and sensitivity tests to see what bacteria are there and what kills them. There's little justification to treat the infection if the underlying conformational defect is just left uncorrected because the infection will simply keep coming back. It's definitely a two-pronged attack. Fix the plumbing, clean the pipes.
Fix the plumbing, clean the pipes. I like that. So we've talked about air getting into the vagina, the pneumovagina, but what happens if that air doesn't stop there? What if it manages to get all the way into the uterus itself? That's when we're dealing with pneumoterus, isn't it?
This raises an important question. Yes, exactly. That's when we're dealing with pneumoterus, which refers to the abnormal presence of air within the uterine lumen, the actual chamber of the uterus. And what's fascinating here, or maybe just logical, is that it's almost always a secondary complication of severe pneumovagina. The air manages to pass through a compromised cervix into the uterus.
So it's gone deeper than just windsucking. Besides the initial pneumovagina allowing air in, what else contributes to air getting all the way into the uterus? Is it just the air pressure?
Well, key contributing factors include cervical incompetence or laxity. The cervix isn't doing its job as a barrier. This can result from issues post-foaling, particularly unrepaired or maybe poorly healed cervical lacerations. Damage from foaling is a big one. Even chronic endometritis itself can cause the cervix to become lax over time, allowing air to pass more easily. You can also have uterine inertia, or aatony basically, a flaccid uterus that lacks tone. This makes it more prone to distending with air, like an empty bag. And sometimes, though rarely, it can even be iatrogenic.
Meaning caused by a procedure.
Exactly. Inadvertently introduced during a medical procedure if extreme care isn't taken during, say, insemination or lavage.
Okay, So how does a mare with pneumouterus present? What are the clinical signs, and what's the definitive telltale sign vets look for to confirm it?
Well, the primary clinical sign, similar to severe pneumovagina, is often infertility or subfertility. That air creates a really hostile uterine environment, leading to inflammation and infection. It almost invariably leads to recurrent endometritis because air in the uterus creates an ideal anaerobic environment, meaning low oxygen for certain bacteria to grow, fueling persistent uterine infection. But the definitive sign, and this is really important for diagnosis, is visible air bubbles on transrectal ultrasonography.
Ah, you can actually see it on the ultrasound.
Yes, the air appears as highly echogenic, which means bright white foci within the uterine lumen. Sometimes you see characteristic patterns like comet tail artifacts. Seeing that air on the ultrasound is what transforms a suspicion into a concrete diagnosis. And while it's often linked to pneumovagina, it's worth noting a mare can surprisingly have pneumoterus even with good vulvar conformation if the cervical seal itself is compromised for some reason.
Interesting. So the ultrasound is truly the key diagnostic tool here. Once it's diagnosed, what's the multi-pronged approach to treatment? It sounds like it might be more complex than just a Caslix.
It often is, yes. The very first step is usually addressing the underlying pneumovagina, typically with a Caslix vulvoplasty, to stop the source of the air coming in from the outside. Then, if cervical incompetence is the issue, there are options for cervical management. Surgical repair, called cervicoplasty, might be attempted for significant lacerations, although honestly its success can be variable. There are also temporary things like cervical clamps that can sometimes be used during breeding cycles to try and help seal the cervix and prevent air ingress.
Okay, so you stop the air getting in, maybe fix the cervix. What about the infection itself, the endometritis that's likely present once the air source is controlled?
Right. Beyond that, treating the endometritis is absolutely crucial. This involves thorough and often repeated uterine lavage, flushing the uterus with large volumes of sterile saline to remove all the inflammatory debris and exudate. Intrauterine antibiotics are then instilled, again, ideally guided by culture and sensitivity results. We want to use the right drug for the bug. In more severe cases, systemic antibiotics, given by injection or orally, may also be used to fight the infection from all angles. And sometimes, during the breeding cycle, hormonal support can help. Using oxytocin can promote uterine contractions to help the uterus clear itself out, or using prostaglandin F2 alpha, another hormone, to induce estrus, which also promotes uterine clearance. And of course, all breeding management, like artificial insemination, needs to be done using very careful sterile techniques to avoid introducing more contaminants.
It sounds quite intensive. So what does this all mean for the mare's future? Let's talk about prognosis and prevention. For an owner with a mare suffering from these conditions, what's the outlook for her fertility?
Well, it varies. For uncomplicated pneumovagina, the prognosis for fertility is actually excellent with a properly performed Caslix operation. It's often a huge positive, leading to a complete turnaround. Many mares go on to conceive and carry normally.
That's incredibly reassuring for those cases.
Mhm.
What about if it's progressed to pneumoterus? Does that change the odds?
It can, yes. For pneumoterus that's secondary to pneumovagina, the prognosis is still considered good to fair for fertility, assuming the underlying pneumovagina is corrected and the endometritis is successfully treated. But it might require more intensive management, maybe several treatment cycles involving those lavages and antibiotics we talked about. It takes more work.
Okay, good to fair. But I imagine the outlook becomes more guarded for the really severe, long-standing cases.
Absolutely. Mares with chronic pneumoterus, especially where it's led to irreversible uterine damage like scarring or fibrosis, or those with uncorrectable cervical incompetence. Unfortunately, they have a guarded to poor prognosis for future fertility. The damage might just be too extensive at that point. So the critical takeaway here really is that early diagnosis and intervention are absolutely vital for both conditions. Catching it early is what prevents progression to chronic endometritis and potentially irreversible infertility.
That makes perfect sense. And for prevention, what's the most important thing horse owners and breeders should be doing? How can you try and avoid this?
It really boils down to vigilance and careful selection. Regular examination of a mare's perineal conformation is so important. Especially check older mares, mares who had multiple foals, or those with a history of foaling complications. Just take a look back there regularly. And for breeders, selecting brood mares with excellent vulvar conformation in the first place is a key preventative measure. It can save a lot of heartache and expense down the line. Choose mares with good anatomy.
That's great advice. Well, this deep dive has certainly provided, I hope, you listening, with a comprehensive understanding of these really crucial equine reproductive health issues, going far beyond just surface-level information. It really highlights how much a seemingly small anatomical detail can impact a mare's ability to conceive and carry a foal. So here's a final thought to mull over. Given how crucial anatomy is to a mare's reproductive health, what other subtle physical traits might be silently impacting an animal's well-being and fertility that we might overlook in our everyday observations? Something to think about next time you're looking at your animals.